Well, welcome, Kris. Thank you for agreeing for this public health career interview. This is for Introduction to Public Health and Social Justice. So I want to hear a little bit about you and what is your role?
Absolutely. Well, thanks for having me, Leah. I love to share information about this field and also, get people excited about going into the public health field because it is a wonderful field to be in. So my role, I am Chief Executive Officer and co-founder of Advantage Health Corporation. And Advantage Health is a corporate fitness and wellness company. And we have been around since 2001. And we are based in Bloomington, Minnesota. And we initially started out with corporate fitness center management. And then we evolved into the whole well-being services area. So everything from biometric screenings to health coaching, to lunch and learns, to well-being challenges, and so on. So we pretty much offer the full scope in terms of corporate wellness and fitness services now.
And what is your schooling or degree or certificate needed for your role?
Mm-hmm. So this dates me a little bit, but I started off actually in college in 1990. Gosh, when was it? 1992. And I went to St. Cloud State University and I wanted to be in mass communications. And I quickly realized that I liked being in front of people. I liked communicating, but I also realized that it really wasn't where my passion was. So I quickly looked into other things that might interest me. And there was a degree called community health. And back in that day, there wasn't a whole lot of information about community health. And so I, looked a little bit further into it. And then I saw that, gosh, there's physical education, non-teaching. So I could learn about fitness. I could learn about wellness, not necessarily be a teacher. So that's what I ended up doing for my undergrad. I got a double major, so an undergrad in community health and then physical education, and graduated in 96, and then graduated, and I thought, oh my gosh, now what do I do? I don't even know what kind of jobs to get with this degree. So I quickly applied to graduate school, and I knew that there was this public health degree out there, and I knew that I needed more direction at that time because I honestly didn't even know where to start. And so I ended up getting my graduate degree from the University of Northern Colorado, and that's in Greeley, Colorado, in public health. And so that particular graduate degree just opened up so many doors for me in terms of opportunities for jobs. And it really just gave so much more clarity to my undergraduate degrees. And so I got my public health degree. And then also at that time, the CHES certification was really big, the Certified Health Education Specialist. And so I got that along with my degree. And that's where it all began.
And what would you say for like your staffing and your team? Like, do they have similar backgrounds or are there varied degrees within your company?
That's a great question. So when we hire individuals to work in our fitness centers or with our corporate clients that are rolling out wellness programs, we definitely look for a health related degree. And I see a lot of health promotion majors, community health, public health, kinesiology, exercise physiology, a few recreation type degrees too, health education. And we really like to see some additional schooling also in things like marketing or, business or, a minor in those areas is actually really, really helpful just because with corporate well-being clients, you tend to do a lot of different things, not just, wellness programs, but promoting those programs, communicating those programs, and really, reaching out to folks in many different ways. So certifications are really big in our field in addition to the degree.
Perfect, thanks. So how were you introduced to public health, or how did you, these are kind of two different questions, and how did you decide to go into public health?
Yeah. So, you start off in college and you might kind of have an idea of what you want to do. And everyone always says it changes, and it truly does, because until you get into that, college environment and you're experiencing new things and talking to different people, and you're always hearing like, do a career that you're going to love, that you're going to want to do for many, many, many years. And I kept thinking about that. And I'm like, gosh, I love to work out. I always, kind of paid attention to what I eat and those types of things. And so I thought, why don't I go into a career where I'm promoting this with others and helping them find success? So when I first got out of graduate school, that's the first thing that I started looking into. What kind of jobs would allow me to do that? And gosh, when I got out of graduate school, it was 1998, and corporate wellness was around, corporate fitness, but it wasn't a really big field. And there were fitness centers within companies, but they were geared more towards the executives. And so it was a field you had to really kind of search out. And so I wanted to get into it and be able to help the entire population, right? Not just the executives. So I ended up getting a position within a company for their wellness program and managing their fitness center. And right away, I knew that I wanted to implement a program that was holistic and that just wasn't focused on fitness, that it looked at mental health and it looked at fitness and it looked at nutrition, because to me that was important at the time, which, fast forward 30 years or so, we know that's absolutely important. So my own personal interest in health got me into the field.
And what was the process of finding the position or role that you're in today?
Mm-hmm. Well, I think I got lucky. Honestly, this doesn't normally happen this way. I mean, I met another individual when I was in my first position, and him and I were both in similar roles for a company. We managed their fitness centers, we ran their wellness programs, and, we thought, gosh, why can't we do this just for a lot of companies? And at that time, there weren't a lot of companies like Advantage Health, and nowadays there's a lot. And so we kind of just started it. We were young and brave, no kids. And so we thought, gosh, let's start a company, Advantage Health. Let's not only offer fitness center management, but a lot of other different things. So by the time I was 25, I had Advantage Health. Things were going well. And I didn't have a business background, which is something that probably would have been good to have. But instead, my business partner and I met with a lot of individuals that did have that background. And so we had a lot of advisors that really helped us start the business and get all of our ducks in a row. And then my business partner and I really, truly took the lead on the things that we knew best, which was fitness and wellness.
And what is your favorite part about your job?
There's many things that I enjoy depending on the day, but I would say really seeing a cultural change within a company. I mean, I think it's great to, help one person or two people lower their blood pressure or to lose weight or to quit smoking. But when you see an actual entire company's culture change because of the programming that you've implemented, or, the wellness teams that you've created, or the senior leadership support that has evolved, that's extremely gratifying, because that's huge to change the culture of a company. And not saying that I've done that all myself. It's a team effort. It takes a village, but that's a pretty big deal. And that's what we're going for. We want to help individuals, but as a population, public health is really driven to do that.
For sure. It's definitely a very rewarding seeing those, even if it's a small success, it's still knowing that you can help them push them into that right direction.
Absolutely. And the corporate field is really gratifying. And that's another reason why I went into corporate wellness versus, other areas of public health. We spend so much of our day at work, whether that's remote or actually at a work site. And so if we can capture those people for those, 8 to 9 hours and help them live a healthy lifestyle, at least while they're at work, that's huge, and something they may not have when they get home.
Definitely. Well, our last question is, any advice or tips for someone interested in a similar position to you, or just for someone who is exploring the public health field?
Absolutely. I have a couple of things to kind of note. First, network. So much of the knowledge I gained to run a business was through networking and, taking people out to lunch or having coffee with individuals and just picking their brains and that type of thing. And, that type of thing is basically free. So, and it's hands-on advice that you can gain. So if there's a field or an area of public health that you're particularly interested in, and you just want to learn more about it, whether it's a clinic position, a government position, a corporate well-being position, talk to people in those fields. And, that is probably some of the best advice you'll ever get. So I definitely encourage networking. And I encourage really building out your resume. And what I mean by that is we always look for the degree, public health, community health, health promotion, all of that, first and foremost. But I really, really like to see the certifications, the training, anything that can really enhance that degree. So we look for personal training certifications, we look for group exercise instructors, we look for nutrition certifications or training, and we look a lot for health coaches that can have that type of skill. The health coaching piece is really starting to boom again, and so health certifications in coaching are huge. And then also, like I mentioned earlier, when you have the skills to market programs and you maybe have, a marketing minor or just some type of training in how to use things like Canva or Vimeo or anything that can really bring attention to well-being programs, that's huge. Because in our field, we tend to wear a lot of hats. And so, as a well-being practitioner, I might not have a marketing person that can put together all my materials. I need to do that myself, and they need to look good and be eye-catching. So I would say to really enhance your communication and your design skills as well. And those are kind of some of the things that I look for. And I would also say to really look into all the different areas of public health. There's really a lot out there. You have to look into them and find what fits for you. Corporate well-being fit for me, whereas possibly working, for a county or in a different position or within a school for school wellness might be another opportunity. So keep your eyes open and be open to opportunities.
Well, thanks, Kris. That was great advice. And thank you again for agreeing to interview with us today. We might follow up if there's any questions from students, but again, thank you for interviewing with us today.
Absolutely. Thanks, Leah.
Thanks.